All right, 5 minutes after 10 o'clock. Thank you for tuning in. This morning, there was a news story about medical tourism. Have you heard these stories? People traveling overseas because some exotic advertisement is luring them, and the health officials in this country are warning, the same guidelines, the same ways to protect us are not necessarily in place in Pakistan or wherever else you might go for some kind of a procedure. Mm-hmm. We have right down in the villages, we have Dr. Juan Yordan, and the show you're about to hear right now has a new name. It's called Regenetiq. I hope I'm saying it right. And Mark Shaw is going to help us out, answer our questions regarding the different services that Dr. Juan Yordan offers. Good morning, Mark. How are you?
Good morning, Larry and Robin. I'm doing well. I hope you are.
I like the name, Regenetiq. Am I saying it right?
That is correct, Regenetiq.
Regenetiq, okay.
Yep, and that is what we are doing. Is I have heard those stories, by the way, of what you're talking about, and people traveling to from Mexico to South America to even Europe to receive treatments, these cutting-edge treatments that have been in the United States since the 1980s. We've been doing PRP for a long time, and it's just most patients and most people are not privy to it and understand it because it's not covered by their insurance. And so they jump on a boat or a plane or somewhere, and they head somewhere to, thinking that they're getting something that is not available to them here in the United States, and it is. That
is scary. And it never even occurred to me that was the reason, that when insurance doesn't cover it, then you don't find out about it.
That's right. Well, it's very simple. When the patient comes in to see your doctors are very good doctors, and they want the best for you and take good care of you, and they understand people's financial constraints, and they look at it and they say, okay, well, if you had diabetes, Larry, okay, there's many medications out there for it. Your insurance company might only carry and say, okay, we're going to cover this medication and this medication, which is a very common thing. And when that happens, the doctor's not going to educate you as to the other 5 medications that are out there, because that might be $100 or $150 a pill. So he's going to say, oh, here are these pills, which they're very similar and very close and exactly of what it is that you need. And there's options for you even in your insurance, but that pill may be $1.50 out of your pocket per pill, okay? So they're not going to educate you as to something that's outside of your insurance, because they have many patients to treat and to see and to take care of. So that's usually what patients get educated on, is what's covered in their insurance.
Wow.
And that's why I get so many patients that go, well, I've never even heard of PRP. I'm supposed to have a knee replacement surgery, and I've never heard about this. Does it work? Is it, and they have a million questions, and, it is no longer, and hasn't been for a long time, medical theory.
Yeah.
It is medical fact. It is evidential-based medicine that we perform here at Dr. Yordan's office, that we've taken people from, for certain knee replacement surgeries, and now they come in and they walk without walkers, without limps, without knee braces, without any difficulties, things that they haven't been able to do in years.
In layman's terms, is the reason that platelet-rich plasma works is because it regenerates the something in the knee, the cartilage or something?
Well, that's correct. It's done predominantly for the degeneration of knees, elbows, backs, hips, and the soft tissue, not bone, but the soft tissue that is utilized in our body as shock absorbers, cushions, padding, such as meniscus and cartilage in the knees, or rotator cuffs in the shoulders. Many people with tennis elbow or anything else, it's because the wear and tear on those causes nerves to be exposed. For example, if your tennis shoe, you wore it for 10 years, 15 years straight, well, the cushion in the sole of your tennis shoe is going to get compacted, and it's going to start to hurt your feet when you walk on concrete and different things, right? It's the same thing with your body. And the reason that it works is because it is your body. It is not It is not a synthetic. It is not a surgery. It's not titanium. It's not anything that we're doing to put in there. It's your own body that produces these things.
Wow. Does it require having to be off your knee for a while? I think I know this answer because I'm watching Joe and Patsy get better.
Yeah. You're right.
But I did have somebody ask me that question online, and I wanted to kind of ask you to answer it.
Larry, it works because it's biology, basically. It's your body has these regenerative properties, and if you were to cut your skin, your body is going to grow new skin. You're not going to walk around with a cut or slash mark on your arm, right? Your body sends stem cells and repair cells to that area to grow new skin. And in essence, the means of traveling to that area is the blood system. And that is what we manipulate. That is what we do. We draw the blood, and we pull those properties, and we concentrate them very highly into a syringe, and we inject that into the problem area. And it's not systemic throughout your entire body. It stays in that area, and it regenerates the knee and the properties of that and those cushions. That it's just simple biology 101 is basically how that works.
Wow.
Everyone has it. Everyone has it in their body.
And you're doing it all the time.
Yes.
Do people have to wear braces after procedures are done for their knee for a little bit, or maybe stay on a crutch or a walker?
No, they do not. It depends on the severity, obviously. If we have a severe case of a patient that's going to go to a knee replacement, and they come in and they see us, for the first couple of weeks we might have them on a knee brace, and we refer to a clinic that's close to us that is a certified durable medical provider, and that custom fits them to their knee brace, just like Patsy and Joe, and they use that for a little while, and then they come to find out, hey, you know what, I really don't need this. This is getting a lot better. It feels better. And that process is anywhere from 4 to 6 weeks that they notice dramatic change.
So if a person is a hiker, that way they can get this procedure done by you, and then hiking will still be in their future.
Hiking will still be in their future. That's correct.
Wow. My son's going hiking this month.
Oh, that's right.
Alex, my son Alex is going hiking in Colorado. I should.
So Larry,
yeah.
What I'd like to do is I actually have Dr. Yordan available.
Oh, good.
To answer medical questions, and to have patients call in if they have anything that they would like to ask, from the realm of diabetes and neuropathy, the pain that they may have, to knees, backs, elbows. Any type of pain that they're experiencing, and they've got questions on that, they can fire away and call in, and Dr. Yordan's here, and he can answer those.
All right. Well, let me get the phone number out while you get Dr. Yordan. The number is 622-9622. If you're looking online or listening online, the number is, the area code is 352. So it's 352-622-9622. This is a great opportunity to speak to Dr. Juan Yordan. He's down in the Villages. He is on the air to answer all of your questions, but I think specifically we're focusing on the PRP, which stands for platelet-rich plasma, and we'll take your calls as soon as I'm sure that Dr. Yordan is on the phone. Doctor, are you there?
Yeah, Doc is here. I'm going to give the phone to him now.
Okay, thank you, Mark.
Hello.
Hey, good morning, Doctor. How are you?
Hey, Larry. How you doing?
Good to hear from you again. Yes, we have some phone calls coming in, so you ready to jump right into them?
Yeah, of course.
Okay, excellent. Good morning. Thank you for calling in. You're on the air with Dr. Juan Yordan.
Hey, yes, I would like to know if there's any contraindication, if there's any prescriptions that would eliminate someone from being able to have this procedure.
Oh, okay. Good question.
Yes, that's actually a very good question. There is some conditions that patient doesn't qualify for procedures, for this type of procedure, for several reasons. First of all, that it might affect some of the cells in their bloodstream. There are some medications that might affect it as well. That depends on what medications are the patient is taking. Now, normally, medications for high blood pressure, diabetes, cholesterol, that is not an issue. That is not a problem. There might be some others. For example, patients that may be taking medications to suppress their immune system. Patients taking certain medications that might be contraindicated for this type of procedure. But normally, the run-of-the-mill medications, like a lot of people take, that's usually not an issue.
Okay. Did you have a follow-up?
What about blood thinner?
Blood thinner.
Blood thinner normally is not a contraindication for this type of procedure.
Oh,
Because
or
it does
anything
not
else
affect.
behind-
It just affects the clotting, not the amount of cells that we're going to collect.
Okay.
Okay, thank you very much.
Thank you.
Bye.
Not
Thank
a
you
problem.
for the call.
Thank you.
All right, let me take another one. By the way, if you want to call in, I'll take them one at a time. The number is 622-9622. Dr. Juan Yordan, good morning. You're on the air with the doctor.
Yeah, can I just have the phone number to call for information?
Oh, absolutely. Let me get the doctor to give you the number. Doctor, can you give the phone number?
Yes, of course. You can call 352-633-0473 and ask for Elizabeth. I'm sorry?
Just a minute. Okay, you can give it again if you don't mind.
Yeah, it's
Go ahead. I'm sorry.
352-633-0473.
Okay. Thank you for that question. Ma'am? Okay.
Thank you.
Thank you.
Thank you.
All right.
Yeah, have a good
well,
day.
and that's important to mention too. It's a pretty sensitive opportunity. I mean, the questions can be sensitive if it's medical in nature, and obviously, a radio show is not where you might want to talk about your own personal circumstances. So, yeah, that's a good thing to have that number.
Yes, I totally agree. Everybody's different, and that's why we make this first appointment as a free consult with the patient. That way, we can go over everything and make sure that it's the right patient for the procedure.
Yeah, that's important to know too. If you are familiar with the WOCA Facebook page, you can also text a question to me, and then I will ask the doctor. It's pretty simple. Facebook.com/ is it newstalk.WOCA?
Yes.
Newstalk.WOCA. There is one here. It says, can you explain what can and cannot be regenerated?
Well, regenerate. Keep in mind that all this changes as we grow older. The changes of arthritis and the changes on the ligaments, on the tendons, all that are just process of we're not 20 anymore. So all those areas can be regenerated. And that's why it's so good and it works so well for joints and different things, because most of the problems now, if you have, for example, a completely torn ligament, that's different. That most of the time needs surgery and all that. But strains and partial tears on ligaments and all that, it's very good, and this helps a lot for that. And then, of course, the run-of-the-mill, arthritis, which is the most common complaint that we get.
You have 3 words in there: regrow, regenerate, and restore. I always thought those 3 words were similar and meant the same thing, but evidently not. They're all separate.
Yeah, I mean, it's not, they're similar and they have some overlapping significance. When you regrow, not necessarily you're regenerating or you're restoring. When you regenerate and you restore, you're not only getting improvement and the changes that it's there, but restoring a patient to their function and activity level and physical. So that's why we identified all those 3 words.
Yeah, we started off the show this morning with Mark, Doctor, talking about another story that was actually in the Reuters, from the Reuters news agency, warning people not to do those medical tourism. People are going to all different countries. They get advertisements in the mail or on their Facebook, whatever, on the internet, and it'll say, get your stem cells your surgery or stem cell treatments and fly over to wherever, and next thing you know, you're in another country and the same regulations. Like them or not, the country has regulations, and that's one thing that makes us feel safe when we go to doctors in this country.
Mm-hmm.
Yeah, and that's very important because all those things are very regulated here. I mean, you go to other countries. I'm not saying that it's not good. I'm not saying, but here it goes by certain steps and regulations. To give you an example, of the machine that we use for our procedure is actually the only FDA approved machine for this type of procedure. So everything is very regulated, and you have to make sure that wherever you go, you have confidence that everything they're using is it's regulated by the FDA, whatever organization regulates the procedures.
If people would like to call in, the number is 352-622-9622. And I'd like to point out before we go to the next call that Dr. Yordan is in the Villages, okay?
Yes.
I'm not talking to a doctor in Europe or in New York or in Philadelphia. He's right here in our listening audience, and that's an important thing to know. Before you go on a medical tourism excursion, you've got somebody right here who knows how to do the medical procedures like platelet-rich plasma can offer. All right, let's go to the phone. Good morning. You're on the air with the doctor.
Yes, good morning. Good morning, doctor. Can you advise us to take any particular vitamin pills for early-stage arthritis?
Well, with arthritis and early-stage arthritis, there's different supplements that may help. It's not that it will, but it might help. Things like, especially things like glucosamine and chondroitin and all that, we tend to use it a lot when it's early stages. Now, if it's on a point that's already taking a toll in your daily living and the way your social part of your life, then it's something to have it checked by a physician instead of just taking supplements.
Is there really any way you can prevent arthritis?
No, actually, it's just part of us, growing older. Of course, there's several things that might get it, might worsen it or trigger a faster arthritic change. For example, previous injuries, patients that did a lot of sports like football and all that tend to have arthritis in an earlier stage. But there's no way, preventing it, no.
All right, thank you.
Okay, well, thank you very much.
Thank you for the call. A question just came in. I have sole pain, and I may be getting this from diabetes. Is there a way to relieve that sole pain? I guess SOLE pain on the bottom of his feet.
Yeah. Well, that depends. There is. If the patient is having pain, it should always be checked because we might assume that it's coming from a previous condition like diabetes, but not necessarily it is. Now, diabetes do tend to create neuropathy, and neuropathy tend to be more often in the feet. So it could definitely be associated with it, but not necessarily. So, the patient should have it checked to make sure that it is neuropathy. And neuropathy normally is a bit different in how it is. It is a discomfort, but most of the time it's associated with a bit of numbness or tingling or burning sensation, not only just pain. So for that listener, for that patient that sent that question, my answer will be, make sure that it is neuropathy from diabetes and have somebody check this. Now, the PRP program that we use is also indicated for diabetic neuropathy.
Oh, okay.
Nice.
Excellent. We have another phone call. Good morning. You're on the air with Dr. Yordan.
Hello?
Hello. Good morning.
Yeah, I wanted to say the person that called for arthritis, I have the worst one, and I'm okay. He can check, it's Cheap Health, playlitrich.com.
Okay. All right.
Yeah.
I thank
So he can find that. If he goes through that, he'll be okay, because I'm 83 years old and I don't have no problem with arthritis whatsoever.
Well, that's good to know. All right. Well, I appreciate you sharing that with us. We have another call coming in. Good morning. You're on the air.
Now, let me, before we go into that question, let me just clarify something about what she said. Just because you don't have pain, it doesn't mean you don't have arthritis.
Oh, interesting.
Okay.
I like
All
that.
right.
I need to get
You know,
a
it's
doctor.
yes.
Dr. Yordan.
So I don't know. I think the other person just left. Oh, here we go. Okay. Good morning. You're on the air with Dr. Yordan.
Good morning. Is there a better... I'm trying to get away from the radio. I'm sorry. I'm wanting to find out if there is a big difference between the cord and the... What is it? The
Platelet, plasma, stem cells?
Platelet. Yes,
Stem cells.
With the cord and the placental, what is the difference there? And it seems like the placental stem cells would be younger and work faster, doesn't it?
Doctor, I don't know that one.
Yeah, let me explain a bit of that. PRP, or platelet-rich plasma, and I'm guessing that what she's referring is to stem cell. It's two different procedures. Okay, PRP is basically your own cells. Keep in mind that the stem cells comes from placentas, not your own, and the treatments are different. We do both. I'm not going to say we don't. We do both, and depending on the patient, one might work better than the other. Normally, the PRP, we normally start with the PRP because, like I said, it's your own cells. It's definitely a whole lot less expensive than the stem cells, and most of the time we can resolve the problem with the PRP and not having to go into the stem cell treatment.
All right. Thank you. Did you have a follow-up?
Wow, that clears that up. Thank you so much.
Thank you. Thank you for the call. Wow, good show today. I wanted to ask you if you have a website that we can direct the listeners to.
The website right now, you can actually use mine. We do have a website that for the treatment that's under construction right now, but you can definitely go to my website at the office, and this is www.drjuanyordan.com, drjuanyordan.com, and there is some information there. And like I said, we're in the middle of constructing a different website for this.
Okay, drjuanyordan.com, and I apologize. I obviously have been saying your name wrong the whole time. So thank you for correcting the pronunciation of your name. I thank you so much for being on the air with us. I want the listeners to know that you are in the villages. That's so important to me because Robin and I speak to so many doctors all over the globe. And it doesn't do anybody a whole lot of good if you can't get to the doctor. It's just informational. Yeah. But in this case, it's more than information. You're actually right here, so...
Yeah, and one more thing, if any of the listeners have a question, and even when we're off the air, they can call our office, and we can connect them to Mark or myself or whatever. We can answer questions that they may have too.
Okay, excellent. Doctor, thank you for being on the air with us today. And for the listeners, we did record this. You can share this with people you are interested in sharing it with. Simply just give us till 2 o'clock today. It'll be up on the internet and on Facebook, and you can share it. Regenetiq is what we're calling the show. And thank you, Doctor. Thank you for being on the air with us today. And thank Mark, please.
Thank you, Larry. No problem. You have a great day.
All right, thank you. We'll be right back.
This is James Snyder, inviting you to join me each Sunday morning at 9:30 for Sunday Joy on 1370 AM, 96.3 FM.
Fox News Radio, I'm Lillian Wu. The president now heading to Hamburg, Germany for the G20 summit after wrapping up his visit to Poland.